So what's up everybody? This is my first video on my laptop I'm recording, and I will be going over something which is a topic I already discussed in the video I uploaded yesterday about females and the effects of testosterone slash steroids on these natal females, such as myself. I'm a almost 21-year-old female who believed that my father wanted another son, even though he was always a narcissist. It was always about him and his feelings, and he would just destroy my older brother, destroy my older sister, and destroy me, specifically the scapegoat of the family. But I didn't come to realize that I deserved to be who I was natally born as, which is a female, until 7 months into the medical transition. And I thankfully didn't get breast surgery. I still have my breasts, and I still have my vagina. I still have my organs. But at the end of the day, we don't know when people like myself that are detransitioned, or even transitioners in general, people that are being medically put on these hormones and surgeries, we have no idea what's going to happen, is what we're being told by Big Pharma, because they want us all to be medical lifelong patients. And this is a very big Pluto and Aquarius, Saturn and Aquarius demonstration of public upheaval, disruption, and overall innovative ways via the government's innovative ways to keep us stuck. And by stuck, I mean separated and divided, because it somehow went from cisgender men, cisgender female, to transgender man, transgender woman, and it's all seen in the astrology, to be honest with you. So I'm going to talk about that. I just did a nice, intro segue. So I'm going to call this video, well, it depends on how much more I talk about, but maybe Piscean's Genius Astrology Stories. Because I'm a Pisces sun, but I also have a Pisces Venus, Pisces Mercury, Uranus is a Pisces. So I'm going to be discussing a variety of subjects that are pretty explicit. So if there's anyone watching that can't handle explicit subjects, please turn this video off. And I'll start off talking about field reports on exogenous testosterone administration in genetic females. And this is something like a post-civilizational apocalypse era is the writing framework for this, from 2026 through 2100. The primary concern: short-term, 1 month to about 2 years, and permanent 3 to 10 years, maybe even more than 10 years. Somatic and sidereal alterations with projected detransition morbidity waves. Now, if you don't know what sidereal is, it's a Vedic astrology, which is not Western astrology. It's a Indian curated astrology. So, report compiled by the collective subdepartments of celestio-somatology, chrono-endocrinology, and astropharmacognosy. Now, I'm not a doctor. Like I said, I'm only a 21-year-old who has been affected majorly by the system and Big Pharma, and I'm just going to talk about it. Not my personal story, but we'll see. So, the Great Conjunction of 2020, which is Jupiter, Saturn, and Aquarius, initiated a societal and medical paradigm of corporal autonomy, leading to widespread hormonal realignment practices. By the 2040s, the retrograde Saturn in Pisces epoch revealed systemic consequences. A surge in detransitioners, souls whose natal chart vitality is in profound disharmony with their altered corporal vessel. Our astro-medical analysis cross-referenced with the Plutonic death rebirth cycles of 2044 and 2078 predicts catastrophic health collapses in this population, necessitating this advanced field guide for scholar doctors of the new era. Departmental field reports. Subdepartment of Celestial Somatology and Morphological Alchemy. It's a report on the short-term alterations of testosterone on born females from 1 through 12 months, so one month up to a year. Vocal apparatus, governed by Mercury, the third house. Rapid thickening of vocal folds begins at 4 to 6 weeks. 4 to 6 weeks. And that's why my voice sounds the way it does. I was on it for 7 months. I was using it daily for 7 months. Mercury retrograde periods observed to cause uneven maturation, leading to vocal fry, instability, and increased risk of astronodular formations, psychosomatic lesions tied to thwarted communication. Pilosecretory systems governed by Mars, first house, vellus to terminal hair conversion in androgen-sensitive zones, face, abdomen, onset 2 to 4 months. Important growth patterns follow the natal Mars signs' elemental quality. Fire signs, rapid, coarse. Water signs, finer but denser in follicular clustering. Dermal and subcutaneous layers, governed by Venus, second house. Sebum viscosity increases by 300%, altering the acidic mantle of the skin. During squares of Venus to Saturn, patients report severe cystic acne, interpreted as a terrain rebellion. The Venus ruled tissue rejecting Mars-ruled chemical influx. Notice how I'm using advanced astrology to talk about something like this, because astrology is everywhere if you actually look. Report on permanent long-term alterations from 3 to 10 years and above. Skeletal remodeling, governed by Saturn in the 10th house. So after 5 years or more, irreversible changes noted. Brow ridge prominence, mandibular squareness, increased bone density in certain asterisms. However, Saturnine burden manifests as premature calcium leaching in later life, post 45 biological age, especially in those with natal Saturn in Libra or the 6th house, signifying inherent structural compromise. Craniosacral and vocal permanence. Vocal drop is permanent after 12 to 18 months, even upon cessation. The mercurial lament, a chronic, untreatable hoarseness, occurs in 22% of long-term users, linked to natal Mercury in fall, Pisces, Sagittarius. Again, my Mercury is in Pisces. Look at what happened to me. Subdepartment of Chronoendocrinology and Visceral Astrology. Report on short-term alterations. Cardiac muscle, governed by the Sun, 4th house. Within 1 month, increased erythrocytosis raises hematocrit, straining the solar engine. Tachycardia and hypertension are common in charts where the Sun squares Pluto. We observe early onset plutonic hypertension resistant to standard treatment, presaging future crises. Hepatic and renal filters, governed by Jupiter, 8th house, and Venus, 7th house. Injectables, esterified T, testosterone, place immediate burden on hepatic detox pathways. Gel users show faster Jupiterian expansion of lipid profiles, triglycerides, and LDL. The house position of Jupiter predicts susceptibility. Jupiter in the 6th house of illness shows 80% higher risk of fatty liver disease. So if you're someone like myself who did not look into her astrological chart and was going through a lot of trauma pre the transition, and then it led to the transition, and now you're figuring out about your astrology and what it all really means, this channel is going to be for you. That's what I'll say. I'm here to help you. So, report on permanent long-term alterations. We have cardiomyopathy and the solar infarction. So after 7 years or more, the heart muscle exhibits hypertrophic remodeling, not from athleticism, but from chronic side rail strain. Mortality from acute myocardial infarction spikes in this population during solar eclipses, activating their natal 4th or 8th houses. The heart becomes a Sun in Scorpio organ, powerful but prone to sudden hidden failure. Reproductive system atrophy, governed by Moon, 5th house. Ovarian suppression leads to permanent lunar desiccation within 2 to 5 years. Uterine atrophy, endometrial necrosis. The most critical finding, the hysterectomy scar becomes a potent astrochakra lesion, disrupting the flow of Luna energy, leading to severe detached Moon syndrome in detransitioners. Intractable emotional dysregulation and autoimmune cascades. Neuroendocrine axis, pineal, pituitary, governed by Neptune, 12th house. Long-term exogenous hormone use causes a feedback loop oblivion. The body's innate hormonal intelligence is erased. Upon cessation, many enter a Neptunian fog, a state of chronic fatigue, endocrine paralysis, and dissociation, as the native hormonal rhythm cannot reestablish. This is the primary pathology of the 2070s detransitioner. Subdepartment of Astropharmacognosy and Detoxification. Here's a report on morbidity of cessation, detransitioner crises. The androgen withdrawal cascade, call it AWC. When testosterone is discontinued, the body, having adapted to a Mars-dominant state, collapses into a void ruled by debilitated Venus and Jupiter. Now, what does it mean to have a debilitated Venus? Well, I have a Taurus ascendant. Now my ascendant is debilitated, but also I have Algol directly on my ascendant. I have Algol, the fixed star, the evil fixed star, Algol, and it's in Taurus, on my ascendant in Taurus. So my life has been fucked up from the start, okay? But debilitated Venus as well. And here's the thing, my Venus in my natal chart is exalted in Pisces. That's also debilitated now, along with my Mercury, which is already debilitated. Jupiter, my Jupiter is in Libra. Some people have Jupiter in Pisces and Jupiter in Aquarius, and this will really get them, I'm telling you. Symptoms include catastrophic hair loss, not reversal of male pattern, profound asthenia, Saturnine depression, and hedonia with crushing somatic weight and reactivation of estrogen-sensitive tissues in a dysfunctional cystic manner, irreversible conditions despite cessation, permanent voice alteration, terminal hair patterns, skeletal changes, and the fractured chart phenomenon, where the natal astrological body map no longer aligns with the physical corpus, leading to chronic sora, itch of the soul, systemic inflammation, and planetary alienation. For example, a natal Venusian experiencing their body as a hostile Martian landscape. For example, someone with a Taurus rising. But I'm growing my hair out now, and I didn't get any surgery, so. Okay. Iatrogenic damage from corrective surgeries. Future scholars must note reversal surgeries, vocal cord thinning, etc. performed under malefic aspects to Mercury or Venus have a 95% failure rate and exacerbate dysphoria. My predictive analysis for the coming waves 2040 through 2100. From 2045 through 2055, I'm going to say there's a first major wave of early duration detransitioners. 2 to 7 years on testosterone. They present with infertility, vocal damage, and cardiac strain. 2065 through 2080, long-duration wave arrives, systemic collapse, epidemic of cardiac deaths, autoimmune disorders from confused immune cells governed by Mars now attacking the Venusian tissues, and soaring rates of siderostatic dementia, early cognitive decline linked to disrupted cerebrospinal fluid rhythms ruled by Mercury and Neptune. And this is why, before I keep going, Big Pharma is beyond evil. How can you do this to people? How can you actually do this to people? How dare you? How dare you ruin billions of people's lives? It's just like we don't matter. And it's not just people that look like myself that are people of color. There are a lot of people that are not people of color that are detransitioners. There are so many detransitioners already. This is a global, this is America being America. I talked about this in my last video where I was discussing this in androgenic exposure in XX individuals. America being America. They want us divided. They want us dying. They want us sick. They want us in their hospitals. They want us to be drained. Like that Nirvana song, Drain You. What was Kurt really talking about? Look at all the lyrics in the songs you listen to, folks. This shit is disgusting. What about The Man Who Sold the World? That's a funny song, isn't it? It actually makes you think, if you want to think critically, about what Kurt Cobain was saying years and years ago. And he was also a Pisces. He said, there was a man who sold the world. It wasn't 5 men or 6 men or 7 men, it was one. And they're still following his principles. Could it possibly be, I don't know, Rockefeller? Anyways, I'm just pissed off. I'm so disturbed and disgusted, and I know it's all in my birth chart why this happened to me, but at the same time, this is just fucked up. This is beyond fucked up. I was born in 2005, and this is, unfortunately, Gen Z and Gen Alpha. We're going to bear witness to most of us, the majority of us. I mean, hell, I was in online digital learning because COVID happened when I was 14, 15 years old. I was in rehab for a lot of high school because of my parents. I've always been alienated from society from the fucking start. So anyways, post-2080, a generation of hormonal orphans, individuals whose endocrine systems are permanently non-functional, requiring lifelong suboptimal planetary alignment-based hormone replacement just to avoid fatal collapse, living in meticulous synchrony with astrological calendars to administer their compounds. It's like, I think I mentioned this in one of my other videos. I'm going to quote Cameron White on YouTube, and he talks about astrology. And I can appreciate his astrological knowledge because I think he's very intelligent, but I also think he's very ignorant in his mannerisms. I don't even really get along with Leos anyways. I have a bunch of Pisces placements. So anyways, what I was going to say is, he said in one of his weekly videos, he was talking about high school, and he was like, oh, we had like a reject hill where, outside people have their own cliques of like, oh, you play sports, here's the sports team, go hang out with the jocks. You like music, well, you're the misfits, or you're an artist, or whatever the case may be. That's like the reject hill. And that's what I think we're going to see with detransitioners on Reject Hill, where it's just like people are refusing to understand us. We're not really getting the medical attention we deserve because that's the thing. They gypped us of our life. There's no way to restore it. Once you've done the damage is done. So, conclusion for the scholar doctor. The administration of testosterone to the genetic female body isn't a simple hormonal adjustment, but a forced planetary realignment. It superimposes a Martian Jovian dominance, active, fiery, expansive, upon a vessel whose foundational blueprint is Venusian, lunar, receptive, fluid, cyclical. Short-term alterations are the body's initial rebellion and adaptation. The long-term effects are a slow, irreversible transmutation into a hybrid terrain that satisfies neither the natal chart nor the acquired signature. The coming century's detransitioner crisis isn't merely a medical or social issue, it's a mass-scale somato-sidereal dissonance event. Treatment must move beyond endocrinology to astrotherapeutics, realigning the patient's lifestyle, herbal regimens, and surgical interventions, if any, with their natal chart's essential dignities, not their perceived temporal identity. The body has a celestial memory. Our task is to help the lost soul navigate back to its original harmonious, albeit scarred, constellation. And then I have a glossary of neoteric terms for scholars. Cyberstatic dementia, cognitive decline from disrupted planetary fluid rhythms. Planetary alienation, the feeling that one's body is ruled by a planetary force, antithetical to one's natal chart. Astrochakra lesion, a surgical or physiological state that blocks the flow of a specific planetary energy. Fractured chart phenomenon, the dissonance between natal astral blueprint and altered physical form. Hormonal orphan, an individual with a permanently non-functional endogenous endocrine system. So that was that, and I'm just going to check something out real quick. See if I have. Just bear with me, everybody. See if we can give you one more thing. But mainly I've been working on like astrology-based stories, so that's why I was gonna name it Piscean's Genius Astrology Stories. But I think this video should be dedicated to the subject at hand, which is detransitioning. So I think we'll leave off here. And yeah, we'll see you guys in the next video, and thank you for watching.